private sector has spoiled us, right? Because we go to Amazon or Google or whatever other private sector tool and they work magic. And that expectation has transferred over to government space, as it should, in my opinion, right? These are people that have sacrificed a ton for their country, and they deserve the best possible user experience, period.
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 349. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about Rock Health's new research about consumers and weight care. What opportunities does the research show for virtual coaching, and what other insights does it highlight about what consumers want when it comes to their weight? I'll talk about that. Then Ryan Thurwell joins us to recognize a milestone that the VA recently passed with its health and benefits app. It's been downloaded more than 2 million times, making it among the most popular digital health apps out there. We talk about the most popular features of the app, insights about connecting digital aspects of a veteran's healthcare experience, and what it all tells us about digital engagement. It's time to dive right in. Are you ready? Let's go.
Flava of the week.
Rock Health's latest research is helping us understand the consumer perspective on the new landscape of weight management tools. And because so many more of those tools involve digital health, I'm especially interested in new opportunities for traditional healthcare organizations to partner for consumer-centered care options that blur the lines of health and wellness. Rock Health recently published the results of a series of surveys to better understand the weight care preferences and experiences of U.S. adults who are overweight or obese. Here are my top 3 takeaways. First, what weight care support do consumers want most? Obesity is a chronic disease, and people need support to manage their weight or restart weight loss efforts. When asked about the type of weight loss support they desire, 33% cited exercise support, 29% said nutrition support, and 15% said mental health support. No real surprises there. Here's the interesting part. Among those who had used virtual coaching for weight loss, the top valued features included activity tracking at 31%, food tracking also at 31%, and weight tracking at 23%. The lesson here is that using the inherent features of the medium of virtual coaching seems to present opportunities to help consumers in the ways that they actually want to be helped. Second, how are consumers thinking about combining multiple approaches to weight loss? Today's clinical guidance for obesity treatment encourages patients to take multiple approaches to weight loss, like dieting and exercising concurrently. Many are following suit by doubling or tripling down on weight loss methods. 64% of survey respondents reported trying 2 or more weight loss approaches simultaneously. Among respondents who previously used or were using GLP-1s, diet, exercise, and stress management were the most common weight loss methods used alongside GLP-1s. The lesson here is that it's complicated to manage obesity, so it isn't a surprise that traditional care has typically shied away from weight management services, especially in the still predominantly fee-for-service world. But the arsenal of available digital weight management tools is greater than ever before, and I expect more experimentation as healthcare organizations see opportunities to combat the complexity through digital health partnerships. We're already seeing it at a faster scale than ever before. And third, how do we put consumer weight care insights into action? Rock Health's research highlights the importance of tailored approaches that address individual experiences, preferences, needs, and barriers. And it's clear that more research will be critical to evaluate and build the best programs. Weight care is not one size fits all. The lesson here is perhaps the most important one: personalized care or don't offer care at all. One of digital health's greatest strengths will always be powering personalization. So success here is incumbent on the ability of care professionals to use that power to do the heavy lifting of individualizing health for every consumer. Bottom line, we're still in the early innings of digital weight care management, but there's nothing stopping us right now from harnessing consumer insights from research like Rock Health's report and building service lines around those insights. After all, that's what consumer-centered care is all about. Let's continue to explore how traditional care can partner with weight care management to improve the health of our society and harness the features of digital health to get us there. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the Week.
The flow, the flow, the flow.
All right, everyone, let's get into the flow. Please give it up for Ryan Thurwell. He's the VA Health and Benefits Mobile App Design Lead. Today, we're going to talk about a milestone that the VA recently passed with its Health and Benefits mobile app and what we can all learn from it, especially from the design side. Ryan, welcome to the Healthcare Wrap.
Thanks for having me.
What would you like our listeners to know about you? I know you mentioned you're a behind-the-scenes kind of guy.
I would just say that, I come from, kind of an old school design background where I worked in advertising and places like that. And it was a little soul-sucking, like I felt like it was just kind of really profit focused. And I always wanted to use my skill set for some sort of do-goodery. And I stumbled into I think what is kind of popularly known as the civic tech space, which is, design, what I call design and government. For me, it was like the perfect nexus of do-goodery and design where there was challenging work that was extremely meaningful and had a high impact. And so those all together for me that was the Kool-Aid I drank and that really got me into it. I've been in federal service since 2015, worked at a bunch of different agencies, OFCIO, GSA, USCIS, a bunch of other acronyms I could probably, like every other government person can, bumble out of their mouth. I had settled here at the VA. It's a unique space to solve really important problems.
I completely agree. There are big problems to solve, and this is a place to help address some of them. So I wanted to bring up this milestone again because a lot of our discussion will stem from it. So this was just in June, very recently, that the U.S. Department of Veteran Affairs Office of Information and Technology, the OIT, announced that its health and benefits app had surpassed 2 million downloads. And I want our listeners to let that sink in a little bit. 2 million downloads for the app. I feel like that's a really remarkable achievement, and I'd love to know how there was such a rapid adoption. Can you tell me more about what led up to that milestone?
Well, I'll start with a couple of caveats, for me personally, just to pick up where we left off, which is that I am standing on the work of those that came before me. I have not been, the design lead of the app since its inception. I kind of came in midstream. So I want to make that very clear that this is not just my doing or anything remote like that. It is definitely a collective from a lot of folks at VA to get that work done. I personally am not surprised that the app hit 2 million downloads because it's really good. It's simple, it's secure, it's easy, it's in the palm of your hand. Government space in general, right, is big. VA itself is a huge organization. And when you can kind of condense all of that into a small personalized thing that's in the palm of your hand that's portable, that can go with you anywhere. I'm greedy and I want that number to be in the double digits personally. So I'm not surprised, but it's good at what it does.
Well, I love that because from an outside lens, it feels like really rapid adoption. And I feel like there are some really useful tips for us all to learn from. Again, it's really helpful to set the context of the conversation, knowing that everything has room for improvement. Everything does involve a lot of those who don't get credit for something. And I love that team attitude that you have here, putting all these things together. And now I'm thinking about some of our listeners who are working on digital health solutions. They're in this space designing digital experiences for somebody else, for a target user themselves. Could you share some of the features of the app and share which ones have been the most popular or most used?
Yeah, I'll rattle off some features real quick, but I do want to talk about why they're popular. The features that are the most popular right now are, I'm just looking at June 2024, are viewing your appointments, looking at your claims, looking at your disability rating, secure messages, which is, messages you send your doctor or receive from your doctor, and then looking at your prescriptions, refilling your prescriptions. But I would say, that's just what's popular in the last month, right? It's one of the things about measurement in general that's difficult in the healthcare space is that just because a number goes up does not mean it is good. Ideally we want fewer appointments because people are getting healthier. So figuring out, what's popular, what's not is only part of the equation. But the reason that those are even on that list is because we worked with veterans to know what to put in the app from the beginning of it, right? We didn't just sit down and look at a bunch of clicks on va.gov and see what's popular and thought that's what we're going to put in the app. We took months, full disclosure. I was against the app. 5 years ago or whenever we were kind of first talking about it, I was like, we don't need an app. They're really expensive. The VA, government doesn't need another thing out there. The website can do everything the app can do. And once we talked to veterans and learned about what they were looking for and the power that comes with a native app, those two things in tandem convinced us otherwise and said, no, this is actually a super useful thing because apps can do what the website cannot. So they're not duplicates of each other. They complement one another, right? Because the VA is its own digital experience. There's a lot of entry points, analog, digital, you name it. The features that are in there that we even started with, which were pretty bare bones at the beginning. I think there was only a handful of like maybe 5 features when it launched. And now there's many. Those all came from veterans, right? So, for the unindoctrinated, this is what we call human-centered design, where you kind of have this continual feedback loop where you kind of have a hypothesis about what users want. You kind of make a small thing, you put it in front of them, you get them to say, validate it, like, yes, this is working, no, it's not. And then you kind of stay in that loop as you kind of evolve and refine product.
There's a lot we can apply there with other digital health tools from what you just said. So along with that, what are some of the benefits that the app provides to veterans?
From the get-go, the app is generally an authenticated experience. What I mean by that is you are, logged in. And what I mean by that is you are logged in meaning you have been verified as you are who you say you are. So the app is generally an authenticated experience. But before you're even authenticated, like the first time you open the app, you can call the Veteran Crisis Line. You can find a VA location, right? The 2 things that we know need to be at everyone's fingertips, regardless of what you have going on. And even inside the app, that Veteran Crisis Line is relatively persistent, where it's kind of always top of mind and accessible from almost every page. The feature-wise, what we call features, you can look at your appointment history or your upcoming appointments. You can check your claim status and see what claims you have open or closed and a history of that. You can refill and track your prescriptions. You can send and receive secure messages with your healthcare team. You can download some common VA letters and documents that kind of go back and forth. That's one of the things I think that's unique about the VA. Like, I know this is a healthcare podcast or whatever, but the VA is more than healthcare, a lot more than healthcare. The VA is kind of like 10 private sector companies under one giant roof. It's super unique, and it's unique from a user experience because basically from the moment you enlist in the military until the end of life, like, you're a customer, right? Which is a pretty rare thing, right? Even in the private sector, they would, they would be really excited to have that kind of customer engagement for that long. But, you can find VA facilities. There's lots of different kinds of VA facilities, both for like mental health, physical health. You can see your vaccine records. And then of course, there's the magic of the app itself, which lets you leverage things like biometrics and Face ID and stuff to make login easier, which we know, like, login, I think this is generally speaking just it's like gravity. Like, login is just generally hard. People don't like to have to log in.
It's so true. When people don't like logging into something, it's a huge barrier for engagement. And it's easy to overlook that when we're identifying things that could prevent an app from providing the benefits that we think it will for its users.
I worked on login.gov for like 2 years. That's one of the things I was at from the beginning. So I have a special place in my heart for login.gov. What's funny about login in general is there's this scale, like this trifecta of balancing act that you have to do. So the easier something is to use, generally speaking, the less secure it is, right? So if you think about going in and out of your house and you only have one lock, it's not super secure, but it's pretty easy to come in and out. But if you want to make that super secure, because you're like, hey, I'm protecting some really important things in this house, I'm going to put 10 locks and maybe 10 different locks with different keys. Well, it's super secure, but guess what? Going in and out, it's a lot harder. It's a lot more laborious. So there's always this give and take between usability and security. And that holds true across any kind of login experience. But one of the reasons the app is great is because we can leverage things like Face ID and biometrics to sustain a longer secure login. So you just literally don't have to do it as much.
Yeah, it's another one of those basics, isn't it? And yet one of those things that's just historically been a challenge to engaging. I'd imagine there are other insights like that have come up along the way throughout the process of getting the app out there and live. Are there other insights that you've learned along the way about connecting your target users with the services that they're looking for?
Oh, so many. I could probably talk to you about that for a long time, but in the spirit of brevity, I would say that, we have learned that veterans want to manage their stuff. Generally speaking, right? They want to manage their health and their benefits. And it feels weird even saying health and benefits because that's just kind of like how VA kind of breaks up because healthcare is so big. It's more like It's healthcare and everything else, which like, I don't know if you've ever looked at that, but like the VA is a long list. Like they do education, they do life insurance, they do careers, they do pensions, they do burials, memorial. And that, by the way, don't forget about spouses, caregivers, service members, like dependents, right? It is a huge space. And unfortunately, in a way, it's good and bad. The private sector has spoiled us, right? Because we go to Amazon or Google or whatever other private sector tool and they work magic. And that expectation has transferred over to government space, as it should, in my opinion. Right? These are people that have sacrificed a ton for their country, and they deserve the best possible user experience. That is like the one thing that I am vocal about, like behind the scenes. And that is my uncompromising demand to deliver the best possible thing. Because to me, this is about delivering the best thing to veterans. And, you know, the healthcare space, which is one part of the VA ecosystem, which is pretty large, in and of itself is pretty gnarly. When I say, veterans want to manage their stuff in one space, when I say stuff, I mean, because it's more than healthcare. It's everything they have going on with VA, which can be a lot. And when I say one place, it could be in your hand on a device of some kind. It could be over the phone. It could be on a website. It could be in a lot of places, but there should be easy access to all of the different parts, no matter what modality I happen to choose that day, and kind of trying to get a cohesive user experience out of that. When you at the VA, which is a big organization, a lot of different teams, trying to get that to be good it's hard, but it's extremely rewarding. And the app is a tool that can do that. The beauty of the app is that besides the fact that it's in the palm of your hand, it's just a couple taps and you can jump from one world, so to speak, into another, where you can see your benefit stuff. You can see your letters. You can jump over and see your health. It's a little more laborious to do that on the web because the web's responsible, right? The web's doing what the app doesn't, right? The app doesn't give you any of those, like, I want to say last time we checked, there are like 600,000 URLs on va.gov. Like va.gov is a huge website, right? And a lot of that is resources, right? It's all the like transparency and it's all the like, here's how to do X or whatever, right? It's just a lot of content. I'll just call it kind of content. It's where you can do a lot of research. You can learn about blah, blah, blah. But when you get like kind of when you cross the line into management, right? Like I no longer need to learn about a thing. I have engaged VA on the thing. Like that's when you kind of enter into like that authenticated, and that's where the app kind of rises to the surface because it just focuses on that stuff, right? So it's not responsible for like giving you page after page of all this different content. It's all it cares about is what you have going on and how can we bubble up that information clearly and get you access to those things.
Absolutely. And that's right where I wanted to go next, which is the focus on our show. Our theme this season is engaging modern consumers because I feel like the word engagement has to some degree lost a little bit of its meaning. It can mean so many different things, at least in the spaces that I tend to be in. And it's one of those things where we use the same word and we're not referring to the same things, especially when I'm talking about a digital experience. What about for you? How are you measuring engagement and how do you know if something is successful?
Yeah. So there's not one number we use, right? Because just like a lot of things, I think I mentioned this before, like if, appointments are going up, it doesn't necessarily mean it's good. It's a mushy thing. So we look at our downloads, right? Like obviously if people are downloading it and using it, that's a good thing. We have customer satisfaction scores, which kind of tells us how happy people are with a product. We look at the app reviews. We have like little like Reddit scrapers, things where we're always kind of like looking for feedback. Like while we do talk to veterans and test things like as we go, like everybody else in the world, they're humans, and human beings, when they know they're being tested, tend to perform one way, but when they're not being looked at, they tend to perform a different way. So for example, a small thing might be like reading. So when we put something in front of a veteran, like, hey, does this make sense to you? And then they read it. They're like, yeah, it makes sense. And then in real life, like no one reads, right? They just, you go to the buttons or you kind of do whatever. And then we find like, hey, wait, this tested really well, but it's not performing as expected. Where's the disconnect there? So we're always looking for feedback that's kind of outside that usability testing, which is often referred to as like qualitative research, which is a smaller number of people, but in a very moderated way, like collecting things. And then there's like quantitative, which is like, how many people are clicking on this thing? Are they able to successfully, refill their prescriptions? Where are people dropping off? is there a page in particular that's confusing? So we use all of those things kind of in concert to kind of have a relatively comprehensive understanding of the landscape that is like, is this working or is it not?
I appreciate you being able to shine a spotlight on the design process and on the benefits for those that it's serving for veterans. The last question I had for you has nothing to do with any of that. It's really simple. If you could pick one guest for us for a future episode of the podcast, who would it be?
I think Kimberly, her name is Kimberly McManus. She is the person in charge of figuring out what VA is doing with AI. And I know that's like a super buzzwordy thing right now, but there is a lot of potential of what AI could help the VA with. I mean, VA, just like any other organization that's been around for a long time, right, has a lot of these bespoke kind of old school systems that were never made to kind of talk to each other, right? Because they never needed to, because they never had to. Now they do, because we're aggregating data and trying to put it in one place so that it and make sense of it. And not only that, but we can't start over, right? And sometimes you're just like, can't we just delete everything and start over, right? Just start from zero. But we can't do that. We can't ignore years and years of health data for people, right? We have to kind of do this midstream. So it's like we're building the plane while we're flying it kind of thing. And AI has the potential to really do a lot of that manual labor of aggregating data, making sense of it, just taking a lot of those man hours away, and giving them back to us so that we can focus on talking to veterans and learning. Because that by far is talking to human beings that are not yourself, right? Because the first rule of human-centered design is you are not a user. It is the most critical because they're the ones that inform what we build and validate it. So yeah, Kimberly would be a great person to talk to.
We will definitely add her to our list then. Thanks so much for that. And with that, that's a wrap for this episode. It's been an absolute pleasure to speak with Ryan Thurwell from the VA. Thanks again for joining us today.
Hey, thanks for having me.